UK.
Adrian Chiles. Listen live, pause, rewind and discover with the BBC Sounds app.
Just coming up to 20 to 1, we started out today talking about cancer in the light of the King's diagnosis, this idea that it shows cancer is indiscriminate, which up to a point it does, everyone can get it, but some socio-economic groups are more likely to get cancer and die from it than others. Obviously, key to all of this, as well as the oncologists, are GPs. So we were really interested to talk to a former co-chair of the Doctors Association UK, Dr. Ellen Welch. She's written a book called Why Can't I See My GP? Thanks very much for coming on, Dr. Welch. This is really a set of testimonies from different doctors, different GPs around the country and indeed the world about its work, and it's fascinating. It's fascinating to read. But if I start with the question, so why can't I see my GP? Is there what can the answer to that be other than there are too many people with too many problems and not enough GPs to see them?
Well, good morning. Thanks for having me on. Yes, that's right. I don't think I've got a snappy soundbite that answers that question in one sentence. The reasons are complex, and there's lots of reasons for that. But yeah, we've got increased demand, we've got less GPs, the system is overwhelmed, and this book is a accumulation of all the stories, and it tries to explain with facts and figures alongside stories from doctors why we're in the current state that we're in.
So go on, take us through the key ones. I know, like, they're all massive stories. The causes of the problem, and there is a problem, are multifactorial, I think is how sort of academics refer to it. Meaning, there's loads of different causes, and unfortunately it's all very complicated. But, just pick a key one out for us. Well,
I think the key one is disinvestment. I know it's a boring one. It's one that people say, we can't keep pouring money into the NHS. But there is so much disinvestment in general practice at the minute. And general practice holds the NHS together. We see the vast majority of contacts with patients every day for the least amount of funds. I think GPs are currently seeing 1.4 million people a day in England. And compare that with A&Es who see a similar amount, 2 million a month. So we see an enormous amount of people, but we've got less staff. We've got 2,000 less GPs than we had in 2015. GP practices are closing, and we need more investment in the services to prop it up again.
So are we asking GPs to do too much? Could that be another aspect of it? Do GPs hold the are they the gatekeepers in other countries?
Well, no. In some countries, people can go directly to a specialist. So certainly in countries like America, you've got a paediatrician, you've got a gynecologist. There are family medicine specialists, but people can go straight to the specialists. And I think if we did that in this country, the secondary care would be overwhelmed, because we do provide a gatekeeper service. But the NHS we have today is very different to the NHS that was set up in 1948. People are living longer, they've got more complex problems, and we've got more access to more tests and more facilities than we did. I think back in the day, the doctor's job was very often reassuring patients, and there's still part of that. That's our job now, but often reassurance isn't good enough in the era of Amazon Prime. People want an immediate solution to their problems, and they often want proof in tests. And the NHS wasn't really built to cope with that sort of demand, and we need to basically think of ways that we can provide good care for people in the system we've got now.
We had a leading authority on health inequality earlier on the show, Professor Michael Marmot, I'm sure you're familiar with. And he made an interesting point about how different people know how to deal with the system, how to make the most of the system. Some people do it better than others. I mean, and because of it, they end up getting a better service, frankly, than and being treated slightly differently, perhaps by health professionals. And I'd be really interested in your take on this. Just have a quick listen to a bit of what he said.
Poorer people see their doctor more often than richer people. So it's not lack of access to care. It's probably something to do with, firstly, that poorer people, if you're got multiple pressures on you, you're trying to make ends meet, you're a single parent, you're in a state of poverty, and somebody says, you've got those pains, you really ought to go and see your doctor about them. You say, oh, give me a break, I haven't got time. I'll get round to it. And then the second thing is what happens when you actually see the doctor. Is the doctor more likely to say to you, if you're high income, highly educated, you say to your doctor, I read in the New York Times last week that this could be a symptom of X. I want you to refer me to a specialist, as distinct from somebody who says, well, I'm not quite sure what I've got, doctor. I'm sorry to waste your time, and maybe I shouldn't be bothering you. And you could see how people got different treatment depending on their level of education and occupation and income.
So do you recognise that picture?
Well, I think there is a level of truth in that. I think in life in general, the people who shout the loudest and advocate for themselves are going to do better. And it's a sad truth, I think. I think the NHS is a vast and complicated system that some staff have difficulty navigating. And I think to expect people who are non-medical to navigate it and know where to go and what to do, it is quite a big ask. One of the suggestions that I do have in my book is perhaps putting the NHS on the curriculum. And by that, I mean teaching people how to use it, where to go for certain conditions, and to educate people about the system. So we all use it, but we never get told how to use it.
And I mean, there's a conflict, isn't there, between people being told GPs are incredibly busy and underfunded, and at the same time, they get the conflicting signal that, well, you really must get this checked out, that checked out, go to your GP. Now, these two things sort of work against each other. We sort of got to improve the messaging somehow there, haven't we?
I completely agree. I remember about 10 years ago, there was a trust somewhere in the Midlands, and they were saying that they were struggling to meet their cancer targets. So cancer patients need to be seen within certain timescales, and they were breaching their targets. And the reason they gave for that was because there was a health campaign to tell people to get this symptom checked out, and they felt they were overwhelmed with the demand for people getting things checked out. But you're right, there's a balance. There's certain symptoms as a GP I really do want you to come and see me about, but there's also certain symptoms which are mild and self-limiting. And for example, you've got a cough for a day, that's something you can perhaps give some time to. You can go to the pharmacist, you can sort it out yourself. But a cough that's been there for 3 weeks with no explanation in a smoker is a possible red flag for a lung cancer, and we do want to see it. And it's difficult to know where that balance is.
The NHS England points out that, these are government statistics, there were 50.9 million additional general practice appointments delivered. That's 2023 compared to October 2019. So that would point to improvements. I mean, sure, we've got to be careful, don't fall into the trap that said everything is getting worse.
Mm-hmm. I think it's getting different. So one of the reasons for more contact is because during the pandemic, we switched to do a lot of consultations remotely, as we all know. Now we've got, in some ways, it's easier to send an email and access your GP. I know it's not easy for everyone, but we do get a whole list of patients every day contacting us via e-consult online. And many GP practices now go through them all, triage them, and we end up delivering more appointments because of that contact through the e-consults. But we're seeing more, not only of face-to-face appointments, we're doing more telephone appointments, more home visits. We are doing more of everything, but with less staff and less funding, and it's a perfect storm.
I mean, Jeff and Clive are both texted in and are both of the opinion that it's to do with too many GPs working part-time. Why do so few actually work a full 5-day week? Nearly 70% of GPs work part-time, says Clive, in which he says he's got that from the Office of National Statistics.
Well, they do, and there's a whole chapter dedicated to this in my book, because I think GPs are overdue a rebrand. The way GPs describe their working hours is done in sessions, and without going into the details of it, a session is 4 hours, but GPs don't just work a 4-hour session, they're working probably about 6 hours to get on top of the workload. So what used to be a full week in general practice 20 years ago is not sustainable now. The work is overspilling. So someone who's working part-time, the actual hours they're doing are the same number of hours as a 9 to 5 general working week. So we are doing the hours, but as per our contracts, the session does not define them. So we need a rebrand to tell people, actually, we are doing these hours. We are working very hard. We're not lazy part-timers.
So a point made by Paul from Northwich is there seems to be, there's also some slight buck passing, but in all sorts of areas of the NHS. I've been through this myself recently with a bit of a family health crisis where, social care put you to the NHS neighbourhood team and said, no, it's to do with the hospital. And you got a hospital saying, no, it's that hospital's problem, not this hospital. And the GP and A&E seem to be fighting each other for who should be dealing with stuff. In between, I mean, it's terribly difficult to navigate as a patient.
Completely agree. And that's what we're losing. I think there's been studies that have shown that continuity of care with one GP who knows you, knows your family, saves lives. There's better health outcomes if you've got continuity of care. And we've lost that. We've got a fragmented system because it's just disjointed. And I completely agree. It makes it very difficult.
I mean, we're told to see it. Sorry, you're now being, I'm funneling every moan everyone's got about GPs in your but
Go for it.
But somebody makes the point, and we've all been through this. If you want an appointment, you've got to get into an unseemly scrum at 8 o'clock or 8:30, and just intensively dialing at that time. Why has it got to be like that? Apart from anything else, those of us are able to do that. Others who are hard of hearing or, aren't so, quick on the draw on their keypads and everything are going to miss out.
Well, I completely agree. And I had the same problem myself. My GP practice, I was on the phone for an hour trying to get through for an appointment. But we're more increasingly changing the way that access is done. So I mentioned e-consults before. Most GP practices, if you go on their website, will have a button you can press called e-consult, and you can type your problem in, so you're not waiting in a queue for an hour, and it will be dealt with usually that day or within 48 hours. GPs will triage them. So rather than it being a receptionist, we've got a duty doctor who goes through and triages every contact and decides what should happen. So maybe someone should go to A&E, maybe someone can see a pharmacist, maybe they need a face-to-face appointment, and it's basically triaging that demand. Not every practice in the country will use that, but it's becoming increasingly common, and it's just a way to deal with this demand.
Hey, Dr. Ellen Welch, thanks very much indeed.
Thank you very much.
Thanks very much indeed for